I decided to split chapter 6 in half since it's so long. It's kind of a long chapter. So I'm going to do half this week and then half next week, and then I'll write your quiz. But let's go ahead and get started. Let's see. There we go. Okay, that's what I need. Come on. There we are. Okay. It's about early childhood. So this is in between toddlerhood. This is in between toddlerhood and school age children. This is between age 2 and age 6 or 5, whatever. Bodily growth and change. At about 3, children begin to look more slender and athletic. Their abdominal muscles develop and the toddler pot belly tightens. Their trunk, their arms, and their legs grow longer. The head is still relatively large, of course. Both boys and girls will grow 2 to 3 inches per year and gain 4 to 6 pounds. The early lead a boy has at birth is maintained and will be continued through puberty when girls will catch and pass boys. And we will see that. I have some pictures of girls who are big taller than the boys in junior high school. They're there. Those kids are between 3 and 4 years of age. As you can see, they look like young adults. That's what the kid on the left is my grandson, and that's what he looked like at 3 or 4. That's what he looked like at age 1. That's what he looked like at age 2. There he is at age 3. As you can see, he's still got his pot belly, chubby cheeks, and there he is at age 4. Taller and slender. His head's still big. His head's still large for his body, as you can see, but he has grown up. They just had some Blue Moon ice cream, I think, and they're showing off their blue tongues and blue mouths, of course. Anyway, cartilage begins turning to bone faster after the age of 3, giving children a more rigid structure, which is a good thing. It's usually children become more adventurous, especially after age 2. It requires added protection of the hardened bones, and this is the growth plate on the. This is the arm bones. That's the elbow right here, I do believe. One of the interesting phenomena of children at this age is the flexibility of their hardening bones. When a child hurts a limb, there might actually be damage that is difficult to see on an x-ray. This child has a broken arm, and as you can see it here, but you can't really see it very well here. It's right there. That's where the break is. This is known as a green stick fracture because the bone breaks in a similar manner to a green stick. And if you take a green stick and you try to snap it, it won't really snap. It just stays together. You can bend it and it won't actually separate. And that's pretty much what happens with the kid. You can see the break is right here, and the break is actually right there. And you can see it in this other picture. There's another view of a green stick fracture. This child has had another broken bone right here. That's what this arrow is for. You can see the lump right here on this bone. This is the knee. So there you go. Yeah, that's the kid's knee, and that's the broken bone right there, and that's a previously broken bone. Muscular, skeletal, and nervous system growth increases as children begin to look more and more like little adults. While it is important that children get good food in adequate amounts, many children of this age become picky eaters. A diminished appetite at this age is normal. So they taste things better, a lot better than adults do. So they may not like broccoli. They may not like anything green. They may not like the flavor of green beans. A child may seem to eat small amounts, but it is probably enough to keep themselves properly nourished. So you shouldn't really worry about them at this age. Give them a multivitamin and call it good. Try not to feed them too many snacks. That will make them portly. A child does require a proper amount of sleep for good growth, and this is really important. If you put them to get to bed at 8 o'clock, let them sleep. You don't let them stay up until midnight and then get them up at 6 o'clock in the morning. That's not going to work at all. Maintaining a 20-minute period of relaxation before bedtime will set the mood for a good night's sleep, and this is always good. It'll wind them down. What I used to do with my kids was read to them, and usually within 20 minutes they conked out pretty good. Nutrition, preschoolers eat less in proportion to their size than infants do. Obesity today is more common among preschoolers than we have ever seen before. Fast and snack foods seem to dominate diets. These foods are full of fat and sugar, and that's the reason that they cause obesity. Children should be fed from the 5 major food groups with an eye kept on the fat content. Try to reduce the fat content. Make sure they get plenty of protein. Milk is a good source of protein if they can tolerate it. So is meat. So you need to figure out what type of meat they can eat. Dairy products are good because they have protein as well. Children should be fed. Oh, okay. Meats and dairy products are essential to good bone and muscle growth, and that's one of the things I was just saying. 11% of all 4 to 5-year-old boys and 5% of all 4 to 5-year-old girls are considered obese. Obesity is categorized when body mass index, or BMI, weight in comparison with their height, is in the 95th percentile. The proportion of children ages 6 to 17 who are obese have more than doubled between 1981 and 1991, from 5% to 11%, and that's mainly because we started feeding them more and more snacks. Before 1981, there weren't as many fast food restaurants. Now, in order to keep up with people's lifestyles, we feed them snack food from fast food restaurants. Um, an example of that would be I have a niece who just turned 50, and she can't cook. She lives in Chicago and she eats out every day. Every meal is her either eating a cup of soup for lunch, but it's she can't cook, so she can't make her own food, so she eats fast food every night. Oddly, the standard for obesity has changed from the 85th percentile to the 95th percentile, and still the numbers have more than doubled. And this is really quite worrisome. We let them eat potato chips, we give them snacks, we give them candy bars. Probably not the best idea. You're setting them up for not only obesity but also diabetes in their later life. Obesity often results from an inherited tendency aggravated by too little exercise and too much or the wrong kinds of food. And the too little exercise has a lot to do with video games, which keep the kids inside. And I've noticed this with my own grandson. He's 8 years old, and if you let him, he will play video games all day long and not go outside and not do anything physical or anything that challenges his mind. He won't even watch television. He just wants to play Fortnite. And half the time he's on more than one screen at the same time, which just drives his mother crazy. The environment is influential since children model the eating habits of people around them. Inactivity may be a major factor, and of course, if you live in an urban setting, a lot of urban settings are dangerous, and therefore those individuals are less likely to get any exercise. Some people live in places where they can't go outside. There is no outside to go. Once upon a time in the United States, suburban and rural individuals, it was so safe to go outside that parents would throw their kids out at dawn and not expect them to come back except to eat until dinner time at night. And in the summer, of course, sun doesn't go down until 10 or 11 o'clock. So here these kids are outside for 15, 16 hours doing something physical. Can't really say what they were doing. We used to play baseball all day, literally all day long, and almost and into the night. As weird as that is, obese children often suffer emotionally because of taunts from peers. They tend to become overweight adults, which leads to high blood pressure, heart disease, orthopedic problems because they're too heavy for their joints, and diabetes. Overconcern with body image can lead to eating disorders, especially among girls. In one study, 9 to 10-year-old girls, of 9 to 10-year-old girls, 40% were trying to lose weight. And here, this is how obesity has changed. As you can see, in 1991, there were only 4 states where 15 to 19% of the population were obese. 1995, it's over half the states in the United States, 15 to 19. More than 20%, almost half, over half the states in 2000. So just in less than 10 years, it has gone from not very many obese people to a lot of obese people. Obesity in the United States, once again, as you can see right here in the middle of the country, greater than 25%. This is in 2006. Lots of portly people. The only state where it was between 10 and 14% was Colorado, and of course it's not that way anymore. Comparison to percentages of population classified as obese. The 2 fattest countries in the world, the United States and Argentina. This is the flag of Argentina for both males and females. The 2 skinniest countries, France and Italy. As weird as that is, France uses a lot of butter, but they eat smaller portions. And in Italy, they eat a lot of pasta. They eat a lot of pasta, but they don't eat other fatty foods other than pasta. And these are the rest of the countries. That's England and Finland and Germany and Mexico and Spain, and this is Russia. And of course, we have Russian females are big, but their males are small. Kind of interesting, the why in the world would the Russian males be skinny and their females are large? It's because these guys drink their dinner. They don't eat, they just drink. So alcoholism is a real serious problem in Russia. Anyway, and there you go. All the flags of the countries of Europe. Oral health, tooth decay in early childhood often stems from overconsumption of sweetened milk and juices in infancy. Permanent teeth, which begin to develop long before they appear at about age 6, may be affected if thumb sucking does not stop after age 4. And this is a child who sucked his thumb, and that's after they fixed it. Yeah, it's the same kid. That's after they fixed it. As you can see, they made his, he had that opening. It was an overbite, and this is why, because he was sucking his thumb, and he's moving his jaw back, he was pulling his upper teeth out. And what they needed to do was orthodonture, where they pulled his upper teeth back. Nice white teeth, though. Most adult teeth arrive when primary teeth begin to fall out at about age 6 years. Between 1974 and 1994, the number of children with untreated cavities dropped nearly 80%. Much of the improvement is attributed to adhesive sealants on the chewing surfaces. And I have been part of this almost all my life. We were, and of course you don't remember any of this, but they used to not have fluoride toothpaste. The first fluoride toothpaste was Crest, and they wanted to make sure that Crest actually worked. So they had Crest towns. where they would try out Crest and a placebo. The placebo was Crest without fluoride, and we were part of that. My family was part of that experiment. They used Ohio, Illinois, and Indiana and Michigan, and we were part of that. Unfortunately, we got the placebo, so there were a lot of cavities in my family. Unfortunately, bad teeth in my family. My family has a history of bad teeth, unfortunately. Sleep patterns and problems. Children in different cultures may get the same amount of sleep each day, but its timing may vary. Young children may develop elaborate routines to put off retiring. Transitional objects such as such as teddy bears or whatever, a blanket, or bedtime companions help a child shift from dependence in infancy to independence in later childhood. And when they talk about bedtime companions, they're talking about cats or dogs, some creature to sleep with the child. In one longitudinal study, children were allowed transitional objects at age 4. They tended to be well-adjusted teenagers by age 16, so they were looking at children and whether teddy bears messed them up or not. And the answer was no. It was good for them. Motor skills, gross motor skills involve the large muscles such as running and jumping, sports, dancing, etc. Fine motor skills involve small muscles in the hands, fingers, such as tying shoelaces and cutting with scissors, writing, drawing, etc. This is my grandson. This is my grandson right here. As you can see, he's always sitting beside the cute little girls. Interesting fella. As you can see, he's using his scissors. They were practicing cutting out pictures. Some people were having more trouble than others. She was having trouble. She was having trouble. She was having trouble. This one had already cut something, but they were using their both hands to cut with. My grandson, of course, hasn't done anything yet, but he's at least got them on his fingers correctly. Wait a minute. Well, I'm not going to do that. Okay. Handedness is the preference for using one hand over the other. And as we can see, wait a second, let's see how many of these kids were right-handed, 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 and who knows, and right-handed. This child may be left-handed, and that's why he's having problems. Anyway, okay. Usually, a preferred hand is evident by age 3. Most children are left hemisphere dominant, which makes them right-handed. If the left and right hemispheres are symmetrical, the individual will become left-handed. About 10% of any population around the world are left-handed people. Artistic development, now this gets weird because left-handed people, well, it's only 10% of any population, but once upon a time, and at least in the Christian world, left-handed people were considered evil. As a matter of fact, sinister means left-handed. That's what sinister means. And one of the reasons in the Christian world anyway, the reason that left-handed people are considered evil is because the devil sat on the left hand of God. And of course he was thrown out of heaven, and well, anyway, he was left-handed, and he sat on the left hand of God. Artistic development, children's early pictures show energy and freedom. Later, they will show care and accuracy. Coughs, sniffles, stomach aches, runny noses are part of early childhood. Since the lungs are not fully developed, respiratory problems are fairly common, though not as frequent as they were during infancy. 3 to 5-year-olds average 7 to 8 colds or more, or other respiratory illnesses in any given year. Usually that's because they're around other children. These minor illnesses tend to build immunity and actually assist in fighting off more severe diseases. As a child ages, they will contract fewer and fewer respiratory illnesses. The reason I have this picture is this is the first time he was ever able to touch the cat. That's not really why I have this picture. That's why the picture was taken. He was sick, and this was like 11 o'clock at night. Normally he went to bed at 8, 8:30, but if you look at his face, you can see his eyes are all puffy, and he's running a fever, and that's one of the reasons why he's acting the way he is. And it was 11 o'clock at night, and the cat was dead asleep, and that's why he was able to touch her. Anyway, he wasn't feeling good at all, but that's why I had that picture there. Accidental injuries, motor vehicle injuries, 20% of child deaths due to motor vehicle accidents are alcohol related. Two-thirds of those deaths are due to drunk driver in the child's own vehicle. All the states in the United States require children to ride in special safety seats or to wear seat belts. Children and adults who are small are in danger from airbags, and of course that is dangerous in the front seat. In many states, children are required to ride only in the back seat. In most states, child-proof caps are required on all medications to prevent accidental poisoning. Children born to women under the age of 20 are 15 times more likely to die from accidental injury. Preschoolers and daycare centers are 2 to 4 times more likely to pick up mild illnesses than children raised at home. Diseases such as colds, flu, diarrhea, otitis media, which is another name for middle ear infection, gastrointestinal illnesses, and hepatitis A. Interestingly enough, when I was in the military, I was in 2 hepatitis epidemics, and both of them started in the child care facility on base. In both cases, everybody on base had to get a gamma globulin shot in order to fight the hepatitis epidemic. And of course, they had to close down the flight line until there were fewer and fewer cases. Anyway, 2 hepatitis epidemics, a lot of fun. In the United States, 43% of children between 2 months and 11 years are exposed to secondhand smoke every day. This increases the probability that the child will develop bronchitis, serious infectious illnesses, otitis media once again, burns, or asthma. And of course, that has to do with mom or dad smoking. There are more children living in poverty in the United States than there were in 1973. Low income is the chief factor associated with poor health in children and adolescents. Many times, the health problems begin before birth as the future mother is malnourished and receives inadequate nutrition during pregnancy. Medicaid has served as a safety net for the very poor, and so has the Affordable Care Act since it has been passed. 890,000 children in the United States have high levels of lead in their blood. This happens because they're exposed to lead fumes or eat lead-contaminated food or water. Of course, what is the city in Michigan that had the lead poisoning in the city water? It wasn't Lansing, that's the capital. I can't think of it. Lead-based paints in older houses are also sources of contamination. Lead poisoning is associated with sensory motor problems, lower IQ, poor academic achievement, hyperactivity, and short attention span. Maltreatment is the deliberate I hate this part of the lecture, but we have to do it anyway. Maltreatment is a deliberate or avoidable endangerment of a child. Abuse is an action that inflicts harm, such as physical, sexual, or verbal abuse. Neglect is inaction that leads to harm. For example, not meeting a child's basic needs such as food, clothing, and medical care. This child was dipped in scalding water, and that's why he is burned on both legs and his torso up to his chest and in one arm. He was able to save one arm. Third-degree burns on the lower portion of his body, unfortunately. In 2012, 3.3 million cases of child abuse were reported in the United States involving 6 million children. 78% involved neglect, 18% involved physical abuse, 9% involved sexual abuse. More than half of the reported victims are 7 years old or younger. 1/4 are below the age of 4. Girls are 3 times as likely as boys to be sexually abused. Boys are the most likely to be physically abused or neglected. 8 out of 10 cases of sexual abuse are perpetrated by the child's own parents. Two-thirds of the abuse cases are by the child's biological parents. So it isn't the evil stepmother or the boyfriend. In two-thirds of the cases, it is the biological parents. Now, if you're wondering what happened after 2012, that was almost 10 years ago. I have some more statistics for you. 2018, 4.3 million cases of child abuse were reported in the United States, involving 7.8 million children. If you remember, in 2012, it was 3.3 million, and it was 6 million children. 60.8% involved neglect, 10.7% involved physical abuse, 7% involved sexual abuse. Just over half of the reported victims were 5 years or younger. 26.7% were less than 1 year of age, while 25% were between 2 and 5 years of age. So as you can see, things have gotten worse for younger children. Sexual abuse has gone down. Physical abuse has increased, I think. And neglect has actually gone down. But there are more children being abused. 5 children die every day as a result of child abuse. So that was true in 2012. It's also true in 2018. 80% of the children who die from abuse are under the age of 4 years. 50 to 60% of fatalities due to maltreatment are not recorded as such on the death certificates. And these statistics are the same for 2012 and 2018. 1/3 to 2/3 of child maltreatment cases involve substance use to some degree. Children whose parents abuse alcohol and other drugs are 3 times more likely to be abused and 4 times more likely to be neglected as children of non-abusing parents. 2/3 of children in treatment for drug abuse admit to being abused or neglected as children, and the statistics are the same for 2012 and 2018. Maltreatment by parents represents extremely poor child rearing practices. Family problems are often exacerbated by their poverty, by alcoholism or drug abuse in the family, or antisocial behavior. A disproportionate number of abuse cases come from large, poor, or single-parent families who cannot meet the needs of their children. However, most low-income parents do not abuse their children. This is something to remember. Just because somebody's poor doesn't mean they're abusing their children. Many abusers are lonely, unhappy, anxious, depressed, angry, or aggressive. They tend to have low self-esteem, poor impulse control, and poor coping skills. About 1/3 of abusive parents were abused themselves as children. In 1/3 of the cases, substance abuse is a factor. Abusive parents tend to be overly involved with their children, deprived of good parenting themselves. They tend to be upset by behavior that most parents accept as normal. My mother always said, it is a child's job to make noise. So it never bothered her when her children or anybody else's children were making noise. Abuse may occur when an already stressed parent attempts to control a child physically and ends up shaking, striking, or squeezing the child. Abusive parents tend to have marital problems and fight physically. Their household tends to be disorganized. They tend to experience stressful events. Many isolate themselves from society and have no one to turn to in times of stress. Neglectful parents tend to be apathetic, incompetent, irresponsible, and emotionally withdrawn. And they don't have to be very young to be neglectful parents. Abused children tend to be overly needy or demanding. They tend to cry often or may be unresponsive. The child's greater needs may stem from poor health, difficult personalities, or physical disabilities. They are more likely to be preterm or low birth weight, hyperactive, have a mental deficit, physically handicapped, or have abnormal behavioral abnormalities. Neighborhood factors that lead to abusive environments include poverty, unemployment, job dissatisfaction, social isolation, lack of social service assistance, high crime rates. In societies where societal violence is rare and physical punishment of children is frowned upon, child abuse is quite rare. This is true in countries such as Japan, China, and Tahiti. In contrast, the United States has one of the most violent cultures among the industrialized nations. Maltreatment can produce grave long-term consequences, physical, cognitive, and social problems. They're more likely to repeat a grade. They're more likely to do poorly on cognitive tests. They're more likely to have behavioral problems in school. As infants, abused children tend to have disorganized, disoriented parents, attachment to their parents, disoriented attachment to their parents. They have a hard time developing social skills and tend to have a hard time making friends. They may become either overly aggressive or withdrawn. They tend to be fearful, uncooperative, and less able to respond appropriately to friendly overtures. That doesn't seem normal to them, people being friendly to them, people being nice to them. So they have a hard time accepting people who are nice to them. Reactions to sexual abuse. This is really kind of an interesting group of problems. In preschoolers, what we see is anxiety, nightmares, and inappropriate sexual behavior. If the child is, there's no reason why a preschooler should be sexualized, should have any sexual ideas at all. So if they have any sexual behavior whatsoever, would be considered inappropriate. In school-age children, their reactions to sexual abuse, uncommon fear, mental illness, aggressiveness, nightmares, school problems, hyperactivity, and regressive behavior. So if you see a child that is hyperactive, there is always a possibility that they are not really hyperactive. They are just acting out. They're trying to communicate the fact that they are being sexually abused, and this is something that always needs to be considered. In the vast majority of cases, of course, they will actually be hyperactive, but in select cases, it won't be a real case of hyperactivity. It's the fact that the child is being sexually abused. As adolescents, the individual may suffer from depression, from withdrawal, from suicidal tendencies, attempted suicide, self-injurious behavior, and that's what we see here. This is an individual who burns herself with cigarettes. This is an individual who is a cutter because they're being sexually abused, and this is them trying to, and they do it for two different reasons. One, they don't have any self-esteem, and so they are trying to. It's a pre-suicidal activity. The other thing is they're trying to make themselves unattractive, and that's one of the other reasons that they do it. A lot of physical complaints usually has to do with their reproductive area, or usually it has to do with their stomach, and headaches. Illegal acts, they will strike out in one way or the other since society's not protecting them. They will participate in criminal behavior, vandalism, and whatnot. Running away is very common with these individuals, and of course substance abuse because they have very low self-esteem. While most do not, abused children are more likely to become delinquent, criminal, or mentally ill. A longitudinal study following 68 victims of childhood sexual abuse found that they suffered from lower self-esteem, as I said before. Depression is very common. Anxiety because they're afraid
especially at night. They are very anxious at night because that's usually when the sexual abuse occurs, and of course, unhappiness. Emotional maltreatment and the effects are harder to pinpoint, but the problem is linked to lying, stealing, low self esteem, emotional maladjustment, dependency, underachievement, depression, aggression, learning disorders, homicide, homicide, as curious as that is, and suicide. So they're more likely to kill themselves, and they're also more likely to strike out and try to kill somebody else. Helping families in trouble or at risk, intervention strategies should be comprehensive, neighborhood based, centered on protecting children, and aimed at strengthening families. Of course, one of the things that you need to do if you find a family with where abuse and neglect is common is the first thing you need to do is make sure that the children are taken care of. If you leave them in a dangerous situation, if the problem is the community that they live in, then leaving them in that community is just asking for more trouble. State and local child protective services agencies investigate reports of child maltreatment and determine what steps, if any, need to be taken. And of course, they're always these people walk on a tightrope probably more than anybody else. Do they take the child out of the home? Do they leave the child in the home? If they leave the child in the home, there's always a possibility that the child will die. If the child does die, as happened with the little girl from Albuquerque whose mother pimped her out. She was only 10 years old, and eventually she was murdered by the individual's aunt and her boyfriend murdered the little girl and then tried to chop her up and burn her body, as ugly as that is. So the question is always, whose fault is it? Why didn't they take the child out of the home? Well, of course, this is the tightrope, the razor's edge that the Child Protective Services is always walking. Did she fall through the cracks? Should they have seen this? And that's always the question. Toughest job in the world, Child Protective Services. Aggression. Many children learn aggressive behavior from their families. Aggression is defined as any hostile action that causes fear and leads to forceful contact with another individual. It can be directed to people or things. It can be physical, verbal, or both. It can be positive or negative aggression. In early childhood, physical aggression tends to decrease as verbal aggression increases. Researchers see the ability to make their wishes known and delay gratification as reasons to reduce physical aggression. We see a lot of physical aggression before the children start talking, and here are two non-talking children, and one child is pulling the other's car over, which ought to be interesting. He's pulling it right on top of himself. Research ideas as to where aggression originates. It can be genetic, it can be psychobiological, it can be part of their cognitive processes, it can be part of their family environment. All children act aggressively at times, despite the rationale supporting it. Researchers feel that aggressive behavior can be curtailed by reinforcing pro-social behavior, and that's, of course, what you're trying to do. Trying to get them to act the way they're supposed to act. There are other differences between males and females than reproductive anatomy, of course. Boys are more vulnerable from conception through the first year, but tend to be longer and heavier than their female counterparts. This is a brother and sister. As you can see, the brother's bigger than the sister is. They seem to be more active from birth. I told you the story of my sister. When she was born, my mother expected her to move around. She didn't move at all as a baby. My mother thought she was stillborn, and all of her life she hardly ever moved. She was fairly sedentary. One of the reasons my mother didn't like me as much as as anybody else in the family is because I was really active when I was during gestation. I kicked her all the time, and she hated me before I came out. I was really an active child. I wasn't hyperactive, of course, but I was fairly active, and I seemed to always be getting in trouble. I always seemed to be trying to get on her nerves, as she said. Um, Later on in life, as we both got older, I was her favorite. After I moved out of the house, of course, and she used to call me all the time and complain about all my brothers and sisters. So boys are more active than girls, and my mother would tell you that all four of her boys were fairly active. My older sister hated her brothers because we were we were always making noise and we were always moving around, uh, and she couldn't read. We were making too much noise for her to read. They also react differently to stress. They usually strike out when they're under stress. They usually make a commotion of one kind or another. Gender typing is common in most cultures and tends to be promoted by the males in the culture. This is shown in rougher play with boys and more sensitivity to girls, and of course we do see that. Other gender-related differences: verbal ability. Girls tend to begin speaking earlier and maintain the superiority in verbal ability over boys all their lives. Females are able better speakers than males almost all their lives, or all their lives on the average. Mathematics: after puberty, boys' math scores tend to be higher than girls, and they tend to do better and participate in more complex math courses. Um, Whether this is culturally based rather than actual is up to question, I guess. Spatial ability: boys seem to have a greater ability to manipulate figures in their minds than girls do. And of course, this may be cultural as well. And social influences: girls are more likely to follow adult supervision than boys. Aggression: boys are more likely to use physical aggression in their play and to get their way, while girls, to get their way, they're trying to they tend to be more physically aggressive. While girls participate in more cooperative play and use relational aggression to get their way. They threaten relationship structures as punishment for not getting what they want. Of course, this may be cultural as well. Emotional sensitivity: girls are better able to express their emotions and interpret the emotions of others than boys. This may be cultural as well. That is, this, all of this is quite questionable. It's difficult to see this other than what is the result. But then we live in a culture. We live in the Western culture. Is it the same way in the East? Is Japan, people from Japan and China, do they react the same? And the answer is not quite. Are girls more emotionally sensitive in Asia uh, and India, in Iran and Afghanistan? And the answer is, well, it's really hard to say. It's difficult to see this other than through the eyes of wherever you're from. By age 2 or 3, children understand that they are either boys or girls, and they label themselves as such, and this is known as gender labeling. Of course, um, once upon a time, this was absolutely true. Not so much anymore. Has come in question. We are more accepting of people being gender neutral than we have ever been in the past. So we'll see how this turns out. This was an absolute once upon a time, a couple decades ago. Uh, but since homosexuality and being different is more acceptable in today's society, we'll see if this continues to be true. As children go through the preschool years, children understand that they will grow up to be men or women, depending on their gender. Of course, now we have transgender. This is known as gender stability. And the vast majority of people are this way, but there are people that feel that they are the opposite gender. I had a brother-in-law who decided that he would rather be a she, and now she is named Vivian. She's transgender. So her birth gender was male, and she decided that she would change her gender. So she's transgender. Gender stability. If you talk to him, he would tell you that he's always felt like he was a woman on the inside. Grew a beard, was bald-headed, ugliest lady you ever saw. But of course, now he lives as a woman. Now she lives as a woman. Got married twice, had children with his first wife. Then he married my sister. And they stayed married as husband and wife for about 15 years until he decided that he couldn't handle it anymore. And he told her that he wanted to be referred to as a she. And of course, my sister was quite upset about that. By kindergarten or the beginning of elementary school, children understand that gender will not change according to their wishes or by situation, so that they can be a fireman or a nurse, and this is known as gender constancy. And of course, we'll see if all this plays out in the future. Males are bathed in copious amounts of androgens during gestation, which leads to their masculine behavior during childhood. It is the increased androgens during gestation that seems to make the boy baby act in a masculine fashion. With puberty, male increases in testosterone can surge to 10 times the previous level in a week. If allowed to gravitate toward the people that they are the most comfortable with, boys will play with boys and girls will play with girls. Children will resist playing with opposite sex partners, whether they are forced to or not. Children seem to be unhappy when they are forced to play with opposite sex playmates. And of course, all this gender definition maybe all changed in the future. I may have to rip these parts right out of this lecture if I'm still lecturing in 10 or 15 years, or maybe even in 2 or 3 years. We'll see what happens. When girls and boys play, it often turns conflictual because girls' interactions are cooperative or enabling to sustain play, and boys' play is constricting, where one playmate tends to emerge as the victor. Excuse me. When girls play with boys, the girls have a difficult time because the boys do not respond to suggestions. Boys do not want to resolve the conflict with discussion. They want to have a victor. Some researchers feel that these differing styles may have an evolutionary basis. Males have evolved needing to establish position and rank in a group to survive. The female role in a group is to seek cooperation and provide an environment for the nurturing of offspring. Males have to compete with other males for reproductive rights. Women have to seek cooperation from other women and males to maintain their offspring. And that is where we're going to stop. We're going to stop right here. So there you go. That is the end of the lecture. Next week I'll finish the chapter, I promise. This is chapter 6, first part of chapter 6.